My name is Heather McArthur, and I'm the clinical director of the breast cancer. You want me to start again?
Yeah, just put it close to your chin.
Okay. My name is Heather McArthur, and I'm the clinical director of the breast cancer program at UT Southwestern. And I'm here at ASCO 2025, and we're presenting the TroFuse 012 study, which is an adjuvant study, phase 3 global effort, randomizing patients with high risk residual disease, triple negative disease after neoadjuvant therapy, and randomizing them to standard of care adjuvant pembrolizumab with capecitabine versus pembrolizumab with one of the novel antibody drug conjugates, Sac-TMT, which is a TROP2 directed antibody drug conjugate. So the background for this study is that TROP2 is broadly expressed in triple negative breast cancer, approximately 80% of breast cancers. Sac-TMT is an antibody drug conjugate comprised of an anti-TROP2 monoclonal antibody with a unique linker that's linked to a topo-1 inhibitor with a high drug-to-antibody ratio and does have the bystander effect. And in a prior phase 3 study, the OptiTROP Breast-01 study in heavily pretreated triple-negative breast cancer, it showed very promising results with progression-free survival improvements and overall survival improvements. And whenever we see those kinds of advantages in the metastatic setting, we typically move those same strategies into the curative intent setting to see if we can prevent metastatic disease from occurring. So again, TroFuse 012 is a phase 3 open-label randomized study evaluating Sac-TMT with pembrolizumab versus standard of care in patients who have received at least 5 cycles of neoadjuvant chemotherapy. At least 1 cycle has to be an anthracycline, and they have to have received pembrolizumab in the neoadjuvant setting. So they don't have to have received the entire Keynote 522 regimen, but have to have received the majority of that. Here is the design. Centrally confirmed triple-negative breast cancer using the 1% cutoff for ER/PR and HER2 negative. As I said, they have to have residual disease after at least 5 cycles of chemotherapy. They're randomized within 16 weeks of definitive surgery. If they are to receive adjuvant radiation, they need to have completed their radiation before randomization, and specimens need to be provided for central testing. About 1,530 patients will be randomized 1-to-1 to receive standard of care pembrolizumab with capecitabine versus the experimental arm, which is the Sac-TMT, which is administered every 2 weeks for 12 doses, together with Q6 weekly pembrolizumab. There are several stratification factors, including residual disease and lymph node status, TROP2 expression, and intention to use capecitabine. The primary endpoint for the study is invasive disease-free survival. The study is currently enrolling globally, and we'll be very excited to share those results when they're available.